and it's my pleasure that you were waiting for this valuable time, and we will try our best to provide very important informations which will be helpful for your OSCE success in future. So this is my introduction, and from the institute, our topics today is OSCE case preparation tips. As we mentioned that we are actually here to talk about immediate exam preparation rather, but any new colleagues, new means those who are preparing and thinking for future also. And the OSCE exam diets are more in the coming year. So everybody, we believe that will be benefited. And we have a lot of records, also your YouTube videos are there. Today we will try to give you some informations in a very differently and newly. Just have a look, the OSCE mark sheet. Many of you know about this. This is an just general appearance of the OSCE mark sheet till now. According to the case, there are some positive things you have to do, and these are the negative thing. If you do this thing, you will get actually reduced marks. In this way, mark sheets are arranged. One thing very important here that you can see the markings are on the scales. Be careful and try to understand, doctor. You see, there are 4 scales. The examiner will mark you over the scales, not your diagnosis and others. Yes, definitely you will reach to a diagnosis and your management will be perfect. This is an indirect benefit to reach to a diagnosis. But the directly, your score will be given according to the skills. So consultation skills, you see, it is very less relevant with your the diagnosis and others. This is very, very skeleton of your consultation. This is the consultation skill. Likewise. So we discussed this thing in another discussion class before. The records are available. So we are not going detail here. Just to highlight some words from the mark sheets you see, the things are very, very specified. In the data gathering, we have to focus on the problem in question. Examination, be specific. And you have to have a planning of examination. What will be the expected finding from your patient, from your case? Similarly, management and investigation, we have to consider the patient perspective, and we have to explain everything in the lay people language. Actually, it is important part of the consultation skill, the lay people language. Somehow it is written here by the Royal College. And this is the way of giving the management investigation, explaining both the risk of doing, not doing as well, in addition, benefit of doing. The things, these are the skills we discussed. All the skills are actually discussed before and available. And recently we uploaded all the skills discussion, 4 skills discussion in the YouTube. So we are requesting you to go through, especially those who are new, possibly those who are a little bit earlier, you know about it. So what about the skill? If you look at the video, please just have a look. I'm sorry, the language may not be compatible for all of you today, but the text language is not much important. You just have a look, few seconds, you will understand the difference between skill and the tips or knowledge, rather to say knowledge. So which is more important? I like to repeat, skill is more important as a clinician. Knowledge also important, but if you don't have the skill, with full of knowledge, you will not be successful. You just have a look and have an idea. Just have a look, please. Just few seconds, few seconds. You cannot go inside. You see, just going down and entered inside without any problem. So this is that. Then what is the importance of the skill? I believe you understood it. Now come to our case. For example, one case, already we provided to you some PDFs in the groups. I hope that some of you minimum have seen it. This is prepared for you today to make the session much fruitful. And I believe and hope that minimum some of you will discuss about the PDFs given, the checklist as well as the role play dialogue. And this is the main part of your OSCE exam really. You have to talk to the patient. Anyway, if this is a case like this, common OSCE in instructions are like this. So may I request someone to talk to me just to start with is how to talk, especially those who are a little mature enough and appearing in the coming exam. Please, anyone? This is Mrs. Jamila Akhtar, aged 45. She is waiting to talk to you. Pulse, blood pressure given. Can anybody open the mic, please, quickly? Someone. Are you feeling shy or not? Dr. Habib, fantastic.
Sir.
You just try to talk to your patient today, Mrs. Jamila. Only introduction, nothing else. No need to continue until the end. Just to open up. Still, you
Okay, sir.
don't know what is the patient's problem, right? You don't know the patient's problem. But you understood minimum. The patient is a female today, right, Dr. Habib?
Yes, sir.
And her age is 45 and her some vital signs given. 60 pulse and the blood pressure 110 over 80. Your task, consult the patient, do relevant examination and make a management plan. Is very, very prototype clinical case station and most of the cases are like this. Most of the cases. Already we discussed also previous days before in OSCE recall. Statistically we have seen, and you know those who attended, the most of the cases are like this. Most are chronic cases. So, Dr. Habib, just start maybe 1 minute enough. Not 1 minute, actually, less than 1 minute is enough to introduce the patient and to know what is the problem of the patient. Please welcome Dr. Habib. Start.
Okay, sir. Hello, Mrs. Akhtar. Good afternoon. I am Dr. Habib. Uh, how may I help you?
Good afternoon, doctor. Doctor, I'm actually having fever for the last 8 days. I took paracetamol for the fever, but still I'm not actually feeling well and I'm not actually getting rid of the fever. Please help me, doctor. Thank you, Dr.
Okay, I
Habib.
am.
That's enough. Thank you, Dr. Habib. Enough.
Okay, sir.
I think other colleague may not be willing to comment. But whatever Dr. Habib said, it is good. But in general, Dr. Habib, in the exam, as you are appearing as a GP, better to say I am Dr. Habib, a GP here today. Okay, it would be
Okay, sir.
better.
Okay, sir.
It would be better. So otherwise, it is okay. So you understood, Dr. Habib and others, that your patient presented with a symptom, right? Patient may show you one investigation also, is not it? We don't know. But commonly, patient present with the symptom. What is the symptom? Fever,
Fever.
fever, and fever 8-day duration. Now your thought process should be started now. Okay.
Okay,
So
sir.
what will be our target now? Anybody can share in the discussion, but Dr. Habib is very willing and nicely talking. So, Dr. Habib, what will be your target now as a GP after hearing that patient has the fever?
Sir, at first I want to know about fever characteristics. And
No,
sir, do you?
many things. Sorry, Dr. Habib, just guiding you. Many things you will do, right?
Yes, sir.
You will get many informations in the end. You will examine also. Ultimate target is to reach a diagnosis,
Yes, sir.
right? And then
Yes.
to reach a diagnosis is enough.
Reach a diagnosis, sir, and
Then
then management.
management, because without the diagnosis our management will not be perfect. Okay,
Yes, sir.
and for a good management, what we have to do earlier, we have to take the data, that is the history, we have to go for the examination, we have to make investigation plan, right?
Yes, sir.
That is very very primary talk, very primary talk. But you will understand later on today that in the OSCE, especially in the South Asian pattern, you have to think something more also. Only today's diagnosis and the management is not enough. I think we will try our best to make it clear later. Okay. So, Dr. Habib, as you got that patient having the fever for the 8 days, actually, what you are thinking about the diagnosis? Some common
And
diagnosis?
sir, it may be enteric fever.
Enteric
And
fever means typhoid, you mean? Okay.
yes, sir. And
Then,
typhoid fever.
then
And it may be, sir, mm, any viral fever may also, sir. Any bacterial.
viral fever. Who wants to add here to say something about the viral fever in the 8th day of the fever today?
Dengue or malaria, maybe.
Dengue, doctor, the 8th day, how can you justify? I will not be too much discussing here, just making the discussion fruitful.
Mhm.
Yes, it could be dengue if it is on recovery, right?
Mm.
Any viral illness could it be, but it will be on recovery. Okay, Dr. Tayyaba, please welcome.
Hello.
Yeah, doctor, please.
Sir, it could be malaria
Fantastic. Could be malaria commonly.
and
And
could be
It could be
yes.
UTI,
Okay,
maybe a UTI,
UTI,
chest
pneumonia.
infection, pneumonia.
gas
Yes, sir.
infection, pneumonia. That means now other colleagues are thinking one by one. It could be many things, right? It could be many things because we came to know only that patient having only fever of 8 days. But it is less likely to be an acute viral illness, rather to say, isn't it? Dr. Mohsin possibly talking, or Tayyaba.
Uh,
It is
Yes,
less
sir.
likely
At
that
this
is a
time,
viral
yes.
illness. It is less likely
Yes,
to be
it may
viral
be
illness.
hepatitis, like jaundice, if patient
We
has
don't know.
other.
We don't know patient having jaundice or not. Could be. Again, fever will be on its actually downfall if it is an viral hepatitis. Okay, that means any acute viral disease could be on the recovery phase, more likely. So in the 8th day, more likely it will be bacterial disease, or even the fungal disease, or even the tuberculosis also. We don't know, isn't it? For this reason, we are invading the patient's information. Invading means we are going into with our skills. This is the skill we have to show into the exam. So after this, if I show you this is the data gathering sheet. Actually, it is devised by ourselves for your convenience. We discussed detail before in the data gathering skill classes. It is also available in the YouTube. Today also we will give you the YouTube link later today if you don't have. But we intentionally put one thing I like to address here a little only. Whenever you heard Dr. Habib is here, okay. So our advice is to know about the other symptom associated. In general, the patient usually doesn't have only one symptom, whatever it is. It may be only one symptom, presenting symptom. But if you ask, definitely patient will tell you some other symptoms. Almost you can try, you can test also in your practice. So, Dr. Habib,
Yes, sir.
traditionally, another colleague also, traditionally, our colleagues are telling, can you tell me more about this? Is it, Dr. Habib?
Yes, sir.
I'm repeating. I am patient repeating. Yes, doctor, I am having fever for the last 8 days. I am taking the paracetamol, but I am not getting relief, doctor. Please help me. Dr. Habib, please carry on. Next part.
Okay. Can you tell me more about your problem?
Dr. Habib, repeat the word. Will you tell that? Can you tell me more about the problem, or will you tell that?
Can
Can you
you
tell
tell?
me more about fever? What?
Acha, can you tell me more about your fever?
Okay. Thank you, Dr. Habib. Other colleague who will comment here to ask this, can you tell me more about fever? It is better. Or to ask,
Apart,
do you have any other problem is a good question.
yeah. Apart from fever, do you have any other complaint to discuss with?
Complaint or problem, better word will be problem. So why Dr. Possibly Dr. Mohsin with me now?
Yes, sir.
Oh, thank you. I am not wrong to identify you. So why you are thinking that to ask the second question? Do you have any other problem is better question. Rather than, can you tell me more about fever? Dr. Masin?
Yeah, in case of time saving, we have to, if we ask this question, then we have many answers like vomiting, jaundice. Patient may say that he has any burning micturition or any specific other complaint, which we ask step by step and waste our time at that
That is
data
very
gap.
right answer, Dr. Habib and others.
Yes, correct.
Understand, Dr. Habib?
Yes, sir.
Already we have said before, it could be pneumonia, it could be UTI, it could be enteric fever, it could be what else, some other disease, whatever. Okay. So patient will tell you about the fever, OPD, CATS, onset, progression. You will be asking also, but still you will not reach to the location of the disease. Clear?
Yes,
So
sir.
if you ask the second question, do you have any other problem? If patient tell, doctor, I have cough, then you understood. More likely patient having the disease in the chest, right?
Yes, sir.
If patient say, I am having burning water work, possibly disease in the urinary tract. For this reason, we are emphasizing many often, possibly many of you have seen from my voice, to ask, do you have any other problem? Okay. Anyway, so we designed the role play sheet also like this. Dr. Mohsen, have you seen the role play sheet today? Have you got the time?
Okay.
No? You can see later
Sorry.
also. You can see later.
Yes.
We design these role play in these way also. It will be useful, I believe, later on. So in the way you came, you took many histories from there, informations. I will not detail here. You can see if you are new today. But there are some additional thing, not only the diagnosis, many other things I'm just showing you according to the what I say, the gender, okay, female, especially in the reproductive age. Ask about the 3P, okay, according to the age in the elderly patient, 4ID, and the baby is the P bind, already discussed before. Moreover, any excretory material patient complains of, we have to have some informations, and the very simple mnemonic to remember is the COCA FF. One F especially for the stool. But other thing we can utilize, maybe in the vomitus, in the sputum, whatever it is, whatever it is. Even in the urine also, right? Definitely we ask about the color of the urine, amount of the urine, frequency, urine, many things are there. It will be useful for this reason we put here. So in this way, you completed your data, and one thing we highlighted here, doctor, investigation, it is also data. Next investigation, you will plan later. So you need to ask, already you got the patient of 8 days, Dr. Habib. Do you believe
Yes,
that the
sir.
patient might be seen by other colleague and has done some investigations? What do you think?
Maybe, sir.
Maybe. So if we don't ask, who will tell us? Okay? Who will
Yes,
tell
sir.
us? Who will? So if patient have CBC, other functions, even patient given the blood for the culture, today report is not available. But again, for suspicion of the enteric fever, you will give the blood culture today. It will be unnecessarily repeated. So this is also data. This is our special actual highlights in the data gathering. So this is a big sheet is available with us. If anybody wants, you can send request to us. So after data gathering, so this is the checklist. Checklist. If anybody has seen, Doctor, I like to show you also now. Dr. Habib, should I show the checklist? Doc-
Checklist, sir.
checklist.
Yes, sir. Checklist WhatsApp group you sent, sir.
Have you seen it?
Yes, sir.
Okay, let's see now. Possibly this is the check. Okay, I'm just changing the screen now a little bit. Give me time. Dr. Habib, tell me now. Can you see the checklist here?
No, sir.
Just wait few seconds.
Yes, sir. Now it visible.
This is visible. So everybody, I hope that you can see. This is a checklist prepared for you. 10-minute OSCE checklist for the fever. So your diagnosis is again not important. I'm just scrolling down very quickly, rather. Just follow me, please. This is your introduction. Greet and meet. You have to, in the exam, those who are very new, please be attentive. Knocking the door, wash the hands. This is the sanitization and so on. Introduction with name that you are a GP also. And how to say, you can see in the dialogue in the script, role play script. These are very principles of performance in the OSCE station. Greet and meet. How can I help you? Then data gathering for the fever. So already time frame also given for your convenience. 3 minute 30 second near about. Uh, Dr. Tayeba raised the hand to say anything here, doctor, or your previous hand.
Yes,
Please,
no,
please.
no, sir. I raised it just now. I want to ask, sir, how can we ask, can there be any other alternative ways of asking how may I help you? Or is
Yes,
it
yes,
just that
yes.
we have to ask in this way? So
No,
what could
doctor.
be the other polite questions,
Many,
like
many
in a
other ways,
polite manner?
doctor. Many other ways. And you can see many where also, but we become very familiar and useful in this way. For example, if you like to know from me how to start the greet and meet, you can see in the PDF we have given that. Hello, Mrs. Akhtar, good morning. So no need to say, may I confirm your name and age. Somewhere you can see,
Okay.
may I confirm your name and age. Now you think if you address anybody by name, so you are introducing as well as you are identifying the person as well, is not it? So
Yes,
age
sir.
age is not much important. Age you will ask later also, or age is given in the script also. Okay, in our chamber, name and age is listed before also in the instruction. Just you are utilizing the
So,
information
sir,
you
is it
got.
mandatory? Is it compulsory to confirm the patient identity, or if it is written, we just say, "Hello, Mrs. Akhtar, how are you?" Or we again have to ask, "May I know your name, please?"
No need, doctor. I'm telling
Okay.
the confirmation of identity is mandatory, no doubt. But how you are confirming? You are confirming by telling, may I confirm your name and age? This is one of the very direct way. But indirect way is, good morning, Mrs. Akhtar. So what you are doing now? You are introducing, wishing,
And
as well as confirming the name. Is not it?
okay.
I think that it will be a time saving attitude here. Clear? Time saving. And
Yes, sir.
patient will be happy that you know the name of the patient earlier. Isn't it? For
Yes,
example, for
sir.
example,
It helps in building rapport with the
that
patient.
is the thing. For example, in your chamber, you are seeing patients you have seen 2 weeks before. Frequently, patient is coming to you. You know this Mrs. What I say, Mumtaz, whatever. Okay. So before asking what is your name or may I confirm your name, you are telling good morning, Mumtaz. Is not better, doctor? Patient will
Yes, sir.
think
It is.
that you identified already and you know the patient. You didn't forget your patient. It is rather more friendly. For that, we utilize the technique, doctor. Otherwise, you can ask in many ways, no problem. Okay. Similarly, how can I help you? These we practiced before, and now we are telling our followers or our beloved colleagues. Otherwise, you can say that what brings you here? I think that is sometimes sentencing will be critical and difficult also. And I understood some of the colleagues they have a less English proficiency, unfortunately. And if you utilize a complicated sentence, it will disturb you. So very simple word. How can I help you? Patient will think that you are here to help also. Okay, is one kind of phrase also. Okay, Dr. Tayeba. Now go down.
Yes, sir.
So from there, we are talking about the fever a little here. Actually, we will not be talking too much about the consultation skill and other. So the informations of the fever as well. You can see there going down. Presenting complaint. We have shown OPD cats, including a special part of the fever is if you ask about the peak temperature, definitely what was the record and is it measured in the oral cavity or axilla or other part, usually two areas, or sometimes somebody can use the ear drum temperature by the sensor, right, Dr. Tayyaba and Habib? You have seen it by the sensor, temperature can be recorded,
Yes, sir.
whatever. There will be a difference of oral temperature and the axillary temperature. Is that it?
Yes, sir.
So this is technically
Yes.
important, especially for the fever. I am very astonished today. How many of us today actually asked this thing in our history, doctor? Anybody in your life also? That did you measure in the oral cavity, that is in the mouth or in the armpit? Anybody asked in your life before?
No.
Possibly no. 99% is no today. But is not important now? Understood?
Yes.
Important.
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 1 degree.
So for this reason, I am very actually surprised and actually pleased to share the message to you. So this is very special for the fever, but not for each symptom. But each symptom is OPD cats. This is our mnemonic we have shown before. So then go down immediately as a GP, your responsibility to identify the bad things. I often told before, not the diagnosis. First thing, is your patient emergency or not? So these are the features for the fever. If the patient is emergency or acute, you must see it minimum in the history, or immediately you could do some examination also. If you think the patient is falling down in front of you, before asking many questions, immediately you will go for the vital sign examination like this. So these are some red flags, identify and then go down. Okay. Uh, Sorry, doctor, somebody having interruption of the voice. Check your internet. Check your internet. Check your internet. So after checking the red flag, remember this is the basic structure for each symptom. See the red flag and then go inside more about. As fever is non-specific, patient is telling burning micturition or cough, abdominal pain. It is okay. Patient may not tell you. In this time, by close question, you will be asking in this way one by one. Common symptom of the fever will be the respiratory system. Location will be respiratory system. We discuss many often. Very connected with the environment. So start with the respirology and go down until neurology. You will get the clue. In general, in the fever, most of the time you will get the clue. Exposure history, risk. In the history, you will get it in the social history or personal history. If any sexually transmitted disease or any contact for the tuberculosis and others, all the points are important. Remember it. Any medication taken, even patient got antibiotic also from the medicine shop, and commonly happening in the South Asian countries because this is an open market is open. So paracetamol and antibiotic especially we need to ask about response to medication. Past medical history, any background disease, diabetes, hypertension, kidney disease, or any systemic chronic disease. Immunocompromise for the fever is very important, especially any vaccination status. You are thinking typhoid, Dr. Habib, right? You told the
Yes,
first.
sir.
You didn't ask about the vaccination typhoid. Patient took vaccination for the typhoid in the last 3 months before. Would you expect that patient will have the typhoid again?
Mm,
Less likely.
mm,
Yes.
less likely,
Less,
sir.
rather to
Yes.
say less likely, could happen, but less likely. So in the vaccination, commonly we are asking about childhood vaccination, many influenza, other, but today, febrile patient vaccination, these are very important. Again, the same question. Very often we didn't ask about the typhoid vaccination. What do you think, Dr. Mohsen?
Yes,
this,
sir.
is- this
But
is another
sir, there are
area.
different strains of
Could be there, could be there.
Salmonella.
Even
It will
then,
not cover the
we
vaccine.
are seeing now new informations about the fever evaluation. That is
Hmm.
my talk today. Drug allergy is a traditional thing, especially antibiotic. Social history, smoking alcohol is not relevant with the fever directly, right? Less likely relevant with the relation with this thing. But these are common bad habit, healthy, unhealthy habit throughout the world. So rather, we should not miss for any symptom. Smoking alcohol, it is said as opportunistic health promotion, okay, and the risk factor. But cardiovascular, it will not be opportunistic. It is a mandatory, the personal habit we need to ask. So occupation travel is very important. Family members, that is a contagious disease. Any family member affected or not is a part of the social history. So patient concerns, idea concern, It is a mandatory part. And after the history, you will go to the examination. I will show you the examination a little planning, but I'm showing you the checklist today. Immediately again, look at the patient. Again, rash, pallor, jaundice, level of consciousness, especially for the red flag priority, including other features. Without touching also, you can identify these things. Okay, hydration you can see by touching the skin as well, others. These are important part. And then the vital sign, traditional vital sign, including the oxygen saturation. Nowadays it is included in the vital sign, SpO2. Then, according to the history, you will go to examine first general examination for the fever related, definitely lymph node, skin rash, and PTC. And it will be targeted examination system. Definitely, if you have the cough, you will go to the respirology. Okay, abdominal problem, go to the abdomen. But if you don't have any clue, doctor Habib, if you don't have any systemic clue for the fever, what examination system you will do with all
Sir,
system? All
all
system.
systems, problem, all
Minimum
systems.
minimum respirology, then abdomen, right? Respirology means
Yes, sir.
chest. That means general examination mandatory plus respirology, that is the chest, including heart, then abdomen, and then skin, anywhere, then joint, right? Lower
Hmm.
abdomen, genitalia. But history will help us. History will help to localize where is the disease. Then we will go to that system first. But if you don't have anything, minimum patient might have urinary tract infection. It is also another area I like to show today. We are not telling I will do dipstick test. Those who attended our point of care discussion, point of care test, you can remember we told many point of care test a GP can do. This is one of that. And I advise all of you in your OSCE exam, minimum tell one or two point of care test in your exam. In the OSCE also, examiner will be impressed, no doubt. One of the example is here dipstick test. Because you don't need to send the urine immediately to the lab now. You can see in your chamber. This is the extra flavor for a family physician, for a GP doctor. So this is very extraordinary. I didn't write by myself, doctor. This is my source. Actually, I have collected from the source. Okay, I didn't write anything. The things are here. I just customized something palatable for you. So authors are writing also. They agreed with my sense as before. Dipstick urine. Clear, Dr. Habib?
Yes, sir.
The minimum do it. But if patient have uh, cough, sputum, and other, and you asked about the burning micturition there, you may not do dipstick. This is one of the scenario. But if
Hmm.
you don't have anything, so dipstick you must do. You don't have anything, any systemic clue, must. Okay, and dipstick not only give you the information of the UTI, rather it can give you presence of sugar, protein, and many other informations. Okay, then you go as a part. Overall, the headline is the management. Near about we budget 4 minutes here. Explain diagnosis and differentials in 1 minute. Okay, and a traditional format will be that you say three differential to the patient and two serious cause you are thinking about, including investigation. So explain the investigation 1 minute. Always in those who attended our practice session that after telling your probable diagnosis, then go for the investigation. Okay, Dr. Habib,
Hmm.
understand?
Yes, sir.
And
Understood.
for this reason, I like to do some tests like this. And your investigation plan will be tailored according to your basic information. Suppose today, eighth day, will you go for the NS1 today, Dr. Habib?
No, sir.
No. Rather, we can go IgM, IgG to have a
Yes.
retrospective evidence. And definitely today, blood culture may be needed, urinary may be needed. Okay. Even
Yes,
the
sir.
travel history is there in the endemic area. Malaria, RDT also could be. Chest symptom, chest X-ray. Not all tests for each patient. And these are additional tests. Again, liver function, renal function always needed for any febrile patient, including ultrasound. If you think that patient might have some abdominal problem, ultrasound. If you think meningitis, you will not do, but you make a plan for the lumbar puncture also, right? Sending
Hmm.
in the hospital. As a GP, you will not do, but you have to say that it could be plan and I hope that specialists can do this way. Give an idea. So if meningitis, definitely will refer, no doubt, doing something, and you can give an injection also. In the management plan, you are telling now antipyretic fluids, infection, control advice. It is also less tasked area. Infection control advice. Control means not to affect surrounding people. Okay, not only family, even in his or her workplace. Specific depending on the cause. Okay, management. If it is a viral, we will wait. If enteric fever, we will give treatment for enteric fever. If UTI, we will give antibiotic for the UTI. But any emergency situation, you will refer. Again, the red flag, hypotension, shortness of breath, chest pain, confusion, meningitis sign, persistent fever. Finally, in the station, you have to go make a follow-up plan. If you are not sending patient to the hospital, review in the febrile patient within 1 or 2 days, home care instruction, safety netting is mandatory, and when to return immediately to you or to the emergency. This is called safety netting, and completely you have to say. This is follow up and safety netting, home management including there. Okay. And the closure finally 1 minute. Check understanding, ask questions, thank, and wash your hand. Who can remember how we conclude actually by asking 2 questions? Any of our previous colleague? Can you remember? Last thing, 2 questions in the last time, near about last minute or last 30 seconds. 2 questions. After finishing everything, you explain everything. Ask questions means what 2 questions? Dr. Mohsin should say you are attending long time, including Dr. Tayyab also.
Sir, we asked, do you have any questions for me, or did you understand everything what I have told you up till now? Or if you want to ask me something
Again, Dr.
related to
Tayyab,
this
many
topic.
ways we could ask, but what we actually, this is a training, right? Whenever mentor is giving training, better to follow these same words. It will be easier. There are 2 things. Do you like to add anything more? And another question, do you like to ask anything more? This is our just learning purpose.
Okay.
But you could ask in many ways. But we found that in these sentences, words are very less, right? It will save again few seconds for you, 2 or 3 seconds. For this reason, we developed these 2 sentences, 2 questions. Do you like to ask anything more? Do you like to add anything more? Then usually time is gone, and most of the time is gone. Surrogate also tell that, okay, doctor, there's enough. No need to ask. It will be safeguard for you. Suddenly, you missed something, important thing. If you have time, 30 seconds. For this reason, we put it in the 1 minute. 1 minute means in your practice time, you need to utilize in this way, doctor, according to the time slot. Otherwise, you may not reach at the end of your consultation. For this reason,
So, sir,
this thing.
how we ask the understanding? You have written check understanding. So,
Oh,
how to ask the
check
question?
understanding. Basically, it will be a 3E model. We discussed before 3E model, but 3E model is not fruitful in your OSCE exam. It may be useful in your personal practice. So, last understanding, our lesson is to ask the patient, is it okay? Okay, doctor? Is it okay?
Okay,
There are
all
some
right.
other sentences. Yes, Mrs. Akhtar, does it make any sense to you? So how many words you are using? Does it make any sense to you? Sometime you may forget to say this sentence also. I think that is a little in different types of sentence, but very simple word. Is it okay? Isn't it easiest, Dr. Tayyaba?
Yeah,
This surrogate will
all right.
understand. Is it okay means after telling something, you are checking the understanding. This is the tips. Is it okay? Actually, we learn it in this
Okay.
way. We learn it and accept it. Okay. And finally, washing the hand, it is again another thing often missed. I don't know how many often you have practiced the OSCE case and did you do the wash hand. You may not, but you have to say in practice time, even like ours with our program and courses, the washing hands and others. Finally, you can tell, thank you very much, Mrs. Akhtar. Now I am washing my hands. That means you are talking to your mentor, that you just remind mentor that you are doing it. You can say, otherwise you will forget in the exam. So wash hand is the, so these are the checklist rather, but implementation of the checklist is your job, and you need to practice. Okay, so I'm closing it now. There is some other, sorry, I will tell you our YouTube links. Okay. Now, this is that. I will show you later, doctor. And now I'm going to the, what I say, the PowerPoint now. If you have any query, doctor, you can raise the hand. Otherwise, we are jumping to the next slide. So this was your, what I say, the checklist rather, checklist of the fever. So your diagnosis is not important. You have, did you go through about the checklist of the fever? This is a important part. And we develop these, our practice checklist rather to say, checklist of the examination, history examination, and other many relevant informations. We tried our best to gather everything here in this box. All of some of you might know about it. And after doing each and everything before management, okay, if I say you the data, including examination, Doctor, may I request Dr. Habib to say the key words from here? It is a salient feature to say, Dr. Habib. Can you tell, or you can read also, no problem. It's a very
Okay,
small
sir.
thing. Your patient
No.
is, just tell a story, not robotic reading, doctor. Our patient is Mrs. Jamila Akhtar,
Uh,
like this.
Jamila Akhtar is 45 years
Okay,
and she has a history of fever for last 8 days.
okay.
And she also complained right lower quadrant pain, and he also complained headache for last eight
It
days.
is she, doctor, sorry, it is
She
not
sorry
he, she.
she complained headache for last 8 days, and her BP was 110 and 80, and pulse 60 blood beats per minute, and temperature was 39 degrees centigrade.
It might be given in the instruction before also, might not be given also, this vital sign. Okay. And then
And sir, headache, query, and vomiting, I don't understand.
query means actually it is a chart prepared for you. If you didn't, if patient didn't tell you headache earlier, by the second question, do you have any other problem? Okay. Our Arab colleagues are here. Ish mushkila marra. Like that. Patient telling nothing. Then definitely you are asking here. Understand?
Okay, sir.
Because initially you were thinking 8 days fever in South Asian people, patient telling nothing. It could be enteric fever, but headache is a very significant finding in the fever. High temperature, 39 degree, headache will be associated, including vomiting also. Okay. Patient telling right lower quadrant pain, definitely you will ask about the vomiting. So today's patient telling this thing. These are some positive message given to you. Okay, Dr. Habib, and for
Yes, sir.
everybody. And go on now. Diabetes 5 years. It is not directly relevant with the symptom today, but immunocompromised state you are getting from the diabetes. Loss of appetite, weight loss, and the body ache. So these are the 3A, 3B, 3D, 3C means actually we have shown you our history or data gathering format. We have given the code there 1, 2, 3. So from their headlines, these are the message you have or information we have gathered. In the number 4, to make it easy, Dr. Habib, I am also with you now reading. The patient have the
History of
LSCS
lost
10 years,
segment
right?
10 years back with 1 unit of blood transfusion,
Transfusion previously,
and,
okay.
and she take metformin 500 milligram 3 times daily, and glycoside 80 milligrams BD, and paracetamol 500 milligram 3 times a day, and oral contraceptive pill for last 8 years.
Okay.
And he has a family history of father cardiac death at the age of 50 years, and living with a husband happily, housewife, and cannot do household work right now. I think, sir, it's right now.
Right
Okay.
now, cannot do household work. Cannot
Yes, sir.
do household work means actually it is an impact.
Impact,
Idea,
sir.
concern, impact, right? Idea, concern, expectation, and the impact. Okay, then
And then he has a concern about dengue fever, and
other
he has
systemic query. Number
other
nine was actually other systemic query. Reveal that patient have high color urine.
dehydration. Dehydration. He has high
High
color
color
urine, sir.
urine. So now you can see that some informations from the patient data are directly relevant with the fever, but others are not. Is it?
Yes, sir.
Others are not, but as a holistic approach, others are also important for dealing a patient, right? For example, patient has diabetes. Patient father died at the age of 50 years. Patient may die also, right? For the cardiovascular disease early. Patient might
Mhm.
have cardiovascular risk for the future. We may not discuss it today, but we have to note down as a patient's data. As patient telling, right? That any family.
Mhm.
But our first target is to reach a diagnosis for the fever. These are second line important. So how you will ask, how will you proceed on? It depends upon you. For this reason, you need practice. Otherwise, only reading the book and getting the data like this, okay, you will not be successful in the OSCE exam. So after the history, remaining history, I'm asking remaining history, all data given to you as a quiz question. Any important history actually we are not showing here for the patient? Who can say? But you are thinking that we must know about this of patient Mrs. Jamila Akhtar, age 45. Can anybody?
Sir, bowel history.
Bowel, Dr. Habib. How bowel will help you?
Sir, if I thinking, sir, it's a enteric fever, it's a constipation.
Why you
Is
are
there
asking?
a
You already got the many clues here. It is enough to suspect this is enteric fever. There is a relative bradycardia also, right?
yes, sir.
So how much data you need? There is the trap for you. You know many things. You are asking many things, but for your diagnosis purpose, no more data needed. Okay, you will not manage also. Okay, if a patient telling you, you can pick it up. Okay, if patient have the constipation, you will give some treatment for the constipation. But for diagnosis of the enteric fever, asking about the bowel, not always important. But if patient tell you the abdominal pain for this patient, for example, it may be relevant. Okay,
Yes, sir. Yes,
may
sir.
be relevant for the management part also. Patient telling already right lower quadrant pain. Other colleagues tried to say something. Please open the mic.
Sir, pregnancy and periods,
So
about
what
pregnancy
question
and
will be, Dr.
periods.
Tayyaba?
Sir, we would ask about her last menstrual period
Fantastic,
and
fantastic, fantastic. I was expecting this thing, and you got the clue. Understand, Dr. Habib?
Yes, sir.
Without asking the pregnancy state, how can you proceed with your patient? So this is the thing, holistic approach. Your diagnosis will be okay, enteric fever, you will do investigation, many things, and you will be happy after coming out from the station. But you didn't ask about the pregnancy. You will give many antibiotics, ciprofloxacin or other drug without knowing pregnancy. So you will not be a safe doctor for your patient. Clear? Sorry, Dr. HD. I'm sorry I cannot utter
Uh,
your name.
sorry, sir, you want to ask about blood in stools, possible complication?
Why not? Why not? If you think that I will ask complication, you will ask. But I try
Okay.
to tell you, I'm not telling in general for the fever. By giving the fever or suspected enteric fever, I am telling you the principles of
Yes.
consultation. If you reach the diagnosis, a probable diagnosis, you are not confirming, you will confirm by the blood culture later. If you reach the probable diagnosis, why you will be busy for the diagnostic informations again and again? You must ask about the etiology, you must about the complications, comorbidities, lifestyles, social issues, home environment, many things are there.
Yeah, just to rule
Definitely,
out the red flag.
definitely, Rose,
The
red flag.
OCP may be distracted, sir. Me. OCP for last 8 years, it was distracted with me.
So OCP, the lady might be pregnant also.
Yes,
If
sir.
if you think that OCP is distracting you, that's all. That's all. But she might miss OCP, and you know OCP failure also possible, Dr. Habib.
Yes, sir. Definitely.
So don't no need to argue more. Must LMP in the female of reproductive age. But without any excuse, better not to skip. Okay?
Yes, sir.
For the female. This is mandatory. There may be some other questions also. You, Dr. Possibly Dr. Homadar, or sorry if I am right to utter your good name. And this is the remaining history.
Yes,
Examination
sir.
plan. Examination plan. Okay, let's see now. This is the basic structure for the examination plan according to your patient. If you take very good history data, your examination plan will be very minute and very focused. There is no doubt. Minimum, if I told you, you told also that if patient have the chest symptom, sputum, cough, your examination after doing the general examination definitely will go to the respiratory system. That means to the chest, not to neurology and other also. But this is a routine we designed for you. You start from the hand and end by foot in the down, okay? Leg edema and sacral edema and other. This is very nice line. You can draw also imaginary line. You start from the hand, go up, neck, okay, head, face, and everything, go down, chest, abdomen, and go down, including the genitalia. Accordingly, all things not need they need not to be examined. According to your history, history will guide you, plus general examination will guide you also further. Which system? Definitely you will examine. So these are the list. And bedside test or POCT, we told you in the fever patient, maybe deep stick urine could be important here. So we mentioned in the right side orange box, you see some vital signs, including the deep stick urine, ECG, CBG, okay, oxygen saturation, peak expiratory flow rate. This also actually bedside test. In the indoor patient, in the outside, you can say that the point of care test. You can include many things from here according to your planning. Okay. So after the examination, your diagnosis, okay, you are thinking and you will go for the investigations and you will go for the treatment. So case discussion is here ended now, doctor. Actually, I raised a case for better discussion today. Now, time management already we have shown you. Role play with PDF, doctor. I think, I don't know, possibly some of you didn't see. For this reason, I'm showing you the PDF again. Dr. Habib, can you tell me, is the PDF open to you now in the screen?
Yeah. Yes, sir.
So this is our rule play script designed especially for you. Okay. Uh, OSCE rule play script. Those who will be practicing, you don't need to actually write many script. Okay. You will not be a drama writer, but we are showing you how a role play could be. Like for fever patient in adult, you just look at greet and meet, budget 30 seconds. Already you have done something nicely. So your patient today, fever for 8 days. History and the other history means for the diagnostic history, 2 minute, 30 second. Relevant other history, many other information, 1 minute. This one. So this is the way doctor, patient, doctor, patient. I think you can enjoy this for the fever doctor. Red mark there. What more you like to know? What more you like to know? Patient telling you in this data. Very critical surrogate could be. Eh? What more you like to know? You are asking that do you have any other problem? Any other problem? Patient telling you see the headache already. Any more vomiting, any more problem. Okay. And surrogate telling what you like to know more. So be careful. Your primary presentation was fever. So I will come to know soon, but now I like to know more about your fever. Can you tell me more about this? This is the time. Then patient telling you many points. Okay, you are asking. Patient telling malaise and body ache. Patient didn't tell you before malaise and body ache. So you added you the symptom. Patient taking paracetamol. Is it improving or not? Okay. Persistent severity. So you are going down. Optional question could be, is it increasing or decreasing at any point of time in a day? If you think that viral illness, 3 days, 4 days fever, timing is not more important. But if you think about tuberculosis, timing is important sometime. So OPD CATS, this is the T, you can remember. Systemic symptom review. If patient not telling any systemic clue, this is the review you must do. Okay, including red flags, exposure, social history, diet, about the food, any GI disease should be accompanied with the diet. So enteric fever is a disease of which system, Dr. Habib?
The JIT system.
GI tract. But usually it is said as the disease without localizing feature. Commonly, patient may not tell you abdominal symptom. but
Yes.
abdominal symptom, but it is originally a GI tract disease. For this reason, including the red flags and others, you are going down, drug history, drug history. So these are data, doctor. Actually, finally, focus examination. Budget is 2 minutes. Budget is 2 minutes, including temperature and other. If it is not given in the exam, you must do it. Okay. Throughout even we have shown you the plan. Finally, management advice will take 3 minute time. 3 minute time. I think it will include total 9 minutes. Okay, including the investigation. Investigation budget 1 minute, and finally it will be the other history part is 1 minute. 1 minute mean closing, closing with other issues. If anything remaining, as you are asking that, do you like to ask anything more? Do you like to add anything more? You have to pay some attention to the patient also. Okay. So for this reason, we put 1 minute for you. It is not hard and fast rule. So to encounter a station of the fever patient, we believe this timing will help you. So you can utilize a basic time format. Already I have shown you here, you see in the PowerPoint slide. So 30 second, 2 minute, 30 second, other history 1 minute and examination 2 minute. This up and down means after reaching a diagnosis up to here. When you are asking about do you smoke, do you drink alcohol, in the meantime, you can feel something. You can look at the eye conjunctiva. So overlapping is important. So during examination of 2 minutes, be careful, doctor, my beloved colleagues, be attentive more. How to manage your time. Your budget is basically 2 minutes for examination, but definitely 2 minutes will not be enough for you most of the time. So you will get more 1 minute from here also. Overlapping history and examination. Some data is not very critical. Just only asking. You don't need to be very serious about. Just to ask and remember. Not too much attention needed there. In such history, you can add during examination. Clear, Dr. Habib?
Yes, sir.
For example, do you smoke? Yeah, when you are looking at the fingers, okay? Any
Hmm.
clubbing, koilonike and other. Oh, so I
Very
am
good.
looking your hands and others. Or do you smoke, Mrs. Akhtar, or like this? Parallelly, you can do. It will give you some time. So potentially, you are getting how many time in your history? 30 second, 30 second, 3 minute, and 1 minute, 4 minute, minimum 4 minute. Okay, overlapping with examination. Here also you are talking. So during examination, you will be talking. So minimum you are getting 4 to 5 minutes in the history. This is a potential time management I am showing to you. And then management investigation 3 minute, closer with other issues 3 minute. This is our what I say the checklist for you, doctor. So we are now actually finishing. And any comment now, doctor? Do you have anything to ask now about today's discussion?
Sir, is it necessary to maintain the sequence of during data gathering, like the
No, no,
families?
no, no, no. Not sequence. Actually, according to your patient presentation, you will
Hmm.
modify the data up, down, up, down. Okay? But
Yes, sir.
headline should be there, red flag should be there, idea,
Mhm.
concern, expectation should be there. But our priority will be any symptom presented with, we have to reach a diagnosis, our target. Okay?
Yes.
This is
Sir, another question is, sir, is there any a need of ice breakdown? The patient have a ice, and I will break down it in management part,
how you are
something like
explain.
that.
Can you explain ice breakdown means?
Sir, if someone, the patient was want to know about dengue fever, as he was enteric fever. So, is it necessary to break down it in management part that it is
It
not a
will
dengue
it will
fever?
definitely kill a time. Usually surrogate will not ask. But if surrogate will be tricky, if
Hmm.
surrogate is taught that you will ask these what a candidate will do, examiner will see. At that case, surrogate tell you, doctor, can you tell me more about dengue? But your diagnosis is enteric fever. Okay.
Hmm. Hmm.
Now your skill will be like that. You will keep this topic for later consultation, not today. So how to
Okay,
say to the patient, this is your skill. Okay.
okay, sir.
How will you say, doctor Habib? Patient
Sir,
asking.
I will. I will be discussing with these topics for our next visit.
Yes,
So,
we can discuss the dengue in the next time with you, Mrs. Akhtar. Let's talk about the typhoid, which is I am thinking about. You are suffering from this disease. That's enough.
okay,
But
sir.
I will not ignore the patient. That I will not tell that no need to discuss dengue. Patient have every desire to know about, but it is not important today. This is the thing. Always I will be positive towards the patient. Okay, this is the concept. Okay, any query? Any colleague, please? You can raise the hand also to ask something about. And today I believe that some of you are appearing in the exam in the coming time. And already the application form open. I think many of you applied for, right? Very rush nowadays in this coming diet. So I couldn't see your chat box, doctor. Sorry, if anybody wants to say anything, you can open the mic. Otherwise, we're ending now. Just last few motivating talk to you, doctor. Few second only with us. If you prepare yourself, you have done many things, but without any planning, your success will be like this. Doctor, have you understood?
Yes, sir.
Other colleague also. You have done a lot of things, right? Finally, you cannot skip out by self. So this is the wrong planning can do like this in your in your future rather or fortune. But if you can make good planning, how a broken clock can be useful. Okay? So this is the way and practice will make you perfect. And sometimes we share the message, read system wise, but practice category wise. What is the category? Just I am showing to you now. System already Royal College shown you the system, this is the category. But for your practice purpose, actually we divide the system in a broader in a many ways. And our category already some of you attended before and appeared the exam. There will be chronic, acute, and so on. So you need to practice in this way, but you will learn the cases according to the system. Especially those who are appearing in the coming time, you need to practice in this way. If you study the system wise, many cases, doctor, in our busy life, you cannot finish. If you cannot finish the reading, so your performance, when will you do the performance? You already gone through many cases before. That knowledge is 50%. Add some knowledge more, but practice the case in this way. Some case will be, suppose our fever patient today, enteric fever, apparently acute case, no doubt. But could it be emergency, doctor? Dr. Habib?
Yes, sir. There may be
Yes, if patient is
perforation.
unconscious, perforation, unconscious, it is
Perforation.
emergency.
Yes, sir.
So how to deal an emergency patient? This is separate skill, not like a chronic clinical case. So there are some breaking bad news, counseling station. So you need to do the practice, doctor, and wishing you the best for the coming exam in the January. Already you have gotten this. Okay, best of luck. And again, our another message. Somebody, especially our Arab colleagues, please, doctor, don't mind that as your exam will be in English, try to improve your proficiency. This is some experience I am telling about. So if you talk more in your own language, not only any country I'm mentioning, India, Pakistan, Bangladesh, or others also, try to talk in English in your partner, minimum reading partner. Even at home also, if possible, it will help you a lot. You will feel relaxed in your exam. But if you're trouble in the English, your performance will not be good. So this is our plan, doctor. We are inviting you for your, especially for your examinee, hoping to appear in the coming diet. So we'll get the detail in the group, WhatsApp group. We hope that 14 December, by the mercy of Almighty, we can start. Already few slots are booked already, but we will take only minimum 5 slots for the active participant. So those who are already appeared, think yourself, doctor, to join with us. And for the beginners, but our thing in the practice session, we actually discourage those who are very new, very beginner, I'm sorry to say. These actually course designed for a little advanced candidate, those almost minimum in mid-level achiever, not for the very beginner, because you will not get more benefit from here. Those who are beginner, our plan is the anywhere, anytime reading module, self-learning. Okay. But any new colleague can join here as a listener, no doubt, but not for the active participant. This is a distinction. Think your best, doctor, and hope to see you again in another day. This is the basic module, doctor. You can see detail in the group. So with this few word, inviting you to our WhatsApp, if anybody not there, and ask other colleague YouTube channel. And beyond our MRCGP, this is MRCP plan. Just to inform you those who are in advanced stage. Thank you very much, doctor, for your patient hearing.